Hello, and welcome to Informs' webinar, Changing the Landscape of Healthcare as We Know It, the Role and Impact of Artificial Intelligence, where we will be exploring the impact of AI and how it's currently impacting the healthcare space, specifically legislation and regulations, as well as impact to consumers and what the future may hold for AI in healthcare. My name is Jeff Cohen. I'm the Chief Strategy Officer for Informs, the largest association for the decision in data sciences. Informs members support organizations and governments at all levels as they work to transform data into information and information into insights that lead to better decision-making and more impactful results. Today, we are joined by Anjana Susarla, a Omera Sasaksana Professor in Responsible AI in the Broad College of Business at Michigan State University, and Holly Weiberg, an Assistant Professor of Operations Research and Public Policy in the Heinz College of Information Systems and Public Policy at Carnegie Mellon University. Thank you both for joining us. Anjana, let's dive right into it with a question for you. AI is getting a lot of attention and discussion around these emerging technologies, which have spurred a debate around whether AI is helpful or harmful to society. Can you talk about how these emerging technologies could change healthcare and add some specific examples?
AI plays a visible as well as very invisible role in its impact through how it can change decision-making for clinical prediction, for operations, for public health. So you can use AI to identify irregularities in some blood samples. Medical images and monitoring can be used for diagnosing complex diseases. You can have robot-assisted surgeries. Also, how do hospitals respond, and what is the large-scale sort of public health monitoring against COVID-19? AI predictive technologies have been used there as well. And hospitals have also been able to share information, track patients, even ventilators, EHRs, using AI systems. The challenges, of course, are these large-scale, when we deploy AI at such a large scale societally for so many complex decisions, are there any hidden biases? And one example I would give is there was a case where a neural network learned to associate asthma with lower risk of death from pneumonia. That is because asthmatics with pneumonia were traditionally given more aggressive treatment that lowers their mortality risk, right? So if we are using this kind of an outcome in hospital bed allocation, then those with asthma and admitted with pneumonia could be, deprioritized. So those complex feedback loops between AI and the decision context, I think that can pose a challenge. But there's also marvelous innovations in AI in the healthcare space.
Thank you. Holly, anything you'd like to add to that?
I'd really second everything that Anjana said. I think when deployed well, there is absolutely the potential for positive transformational change in AI in healthcare. Some that's already been realized, and I think the majority that hasn't been realized yet, but kind of lies ahead of us in the not so distant future. But I agree, I think the biggest risk that I see and thing that we think about often in the research space is being mindful of potential biases and the potential disparities that could emerge from deploying these technologies. And there are various ways that can come into modeling and decision making, and we have underlying data that can be biased or that can have underrepresentation of groups that are historically underserved. And we can have more insidious, kind of more subtle forms of bias in data and in the algorithms and their outputs that, if we just blindly apply these methods, can lead to bad or disparate outcomes. And so I think there's a lot of opportunity and need to study that. But overall, I'd say AI can and will be a force for good. We just need to be careful about how we do it.
Thanks. Let me build on that, Holly. I think sometimes the public thinks about AI in healthcare in terms of smart robotics and helping with surgeries or some kind of algorithmic diagnosis. Can you expand on that? What kind of broader opportunities do you see beyond these for AI in healthcare?
Definitely. I think, as you mentioned, a lot of the hype and a lot of the things that we've seen in the media are about these clinical use cases, things like early detection or diagnosis. Even within the clinical realm, there are broader opportunities for AI in healthcare. We've seen a lot of promise in drug development using AI for targeted therapies and kind of more targeted interventions for rare diseases and certain biomarkers. We've also seen clinical trial design really be influenced by AI. But beyond the clinical use cases, Anjana talked a bit about kind of the broader space of healthcare. And I think the verticals that I think about are, there's the clinical use cases, then there's also the operations and more public health, different layers of healthcare and the AI in healthcare. So in operations, I think broadly about kind of processes at the hospital or in health systems and how healthcare is delivered. And we've seen AI is really promising in being used to improve efficiency of existing processes. That could be things like better scheduling of nurses or doctors, better utilization of ORs, or preparation of medical supplies in surgical settings. We also see NLP, or natural language processing, is having a lot of opportunity for extracting meaningful information from clinical text, which is particularly useful in healthcare because so much of that critical information about patient conditions, their symptoms, and some of the details of their treatment live only in free text notes. And so being able to extract that helps clinicians more easily and more efficiently learn about their patients. It also helps the creation of downstream data sets that can be used to build powerful models for these kind of clinical use cases. And then in the public health space, just quickly, I'd say there's a lot of opportunity in using AI for early warning systems, alerting systems of potential disease outbreaks or surges. And we saw that, as Anjana mentioned, in COVID-19 and in other pandemics and other kind of public health crises. And we've seen the power of optimization in AI in being able to better allocate resources across a broad population. And so, there's a lot of opportunity in the clinical space, but AI and optimization's potential really expands much more broadly than that, I would say. Anjana, I don't know if you have anything to add on that.
Yeah, I wanted to add a couple of things. I think that, we think about robotics and so forth, but AI has had tremendous, I think the life-saving applications from AI, literally. It's in the treatment of sepsis, because when people with some complex, healthcare conditions are admitted to hospitals, one of the major risks that hospitals have to watch out is sepsis. And this is a very complex, it's kind of a path dependent. There are so many contributing factors. I think hospitals need to look at all the things that Holly mentioned. Amount of data that we need to sort of put together is just overwhelming. And so this is where powerful artificial intelligence methods can help so much. Let me say on an aside, traditionally healthcare system collected a lot of data through these EHRs. And EHRs were used more like a data storage or repository. Now what we have with advanced techniques is we can use NLP methods, the natural language processing methods, to decode clinicians' notes and combine that with all this complex data that's already residing there in the EHRs. So it's not only like we don't have to even sometimes collect more data. We are sitting on this goldmine of data. We need to understand and get actionable insights better. And let me say that I have twins. One of them had to be in the neonatal intensive care. So some years ago, I was reading this article about how ML methods have tremendously accelerated the treatment of neonatal sepsis, which I thought was just such a fantastic application that, the NICU doctors in neonatal intensive care can benefit greatly from these advances in AI. So once again, I think it's just the fact that we have data residing in so many disparate systems, and now we have the ability to connect data from what all these large language models, from repositories of data that hospitals have, their clinical partners, and we can predict better, and we can do, umbrella of techniques. It's not just all prediction, optimization, prediction, a whole host of methods, but we can do a great job of utilizing the resources we already have.
Listening to you both, it makes me wonder how AI in healthcare might create additional benefit for reaching hard to reach populations, either in rural health or some marginalized populations. I'm wondering if you have any thoughts on that. Oftentimes we think of telemedicine as a way to, particularly in rural healthcare, to address that. But could you take that a step further and talk about what AI might mean for improving quality or access to care among those groups?
I can just quickly jump in and say one aspect which is somewhat understudied, in my opinion, is just health literacy. How can we educate people to deal with their conditions better? And can we just have AI ML methods that can also deliver health literacy solutions at at scale, so that one of the big challenges for healthcare system is really just adherence to clinical guidelines. Can we just improve that gap? So it's not just diagnosing, predicting, but it's also about how we can help people monitor their conditions. How can they sort of report them back, and just sort of bending the cost curve, easing the burden on the system. I think these are great opportunities where AI can help. But I think Holly might.
I totally agree. And I love the point on health literacy and some of these non-clinical, in the hospital type of opportunities that we have. I think definitely to the point that you made, Jeff, there's a huge opportunity in AI and improving access and lowering costs to these hard to reach populations. I think a lot of the work that I do that thinks about this is in how we can use predictive and prescriptive models to better equip rural areas that maybe see lower volume of certain types of cases. And so what you can think of, or the way that I often think about it, is that in medicine, a lot of the work of a clinician is learning from the examples of their patients, right? And understanding patients like this that tend to respond better to a certain type of treatment, or they look like they're at higher risk or lower risk, things like that. And if you're working in downtown Boston in a hospital that sees very high volume of these types of patients, you have a lot of examples to kind of work off of in your mind. And in a rural setting, you may have seen fewer of these more complex, nuanced cases, or like Anjana mentioned, in neonatal sepsis, right? Maybe that's something that hopefully nobody's encountering, but that you encounter even less in a rural setting because there's a lower volume of patients. And so if we can have these models that are trained on multiple sites, these diverse populations nationwide, that can then be deployed in these lower volume centers, there might be an opportunity to kind of learn from these larger samples and all of the breadth of patients that are seen that you may not see in these rural areas. So I think there's an opportunity to equip rural practitioners with kind of the experience of these higher volume centers. And I'd say on the reverse, there's also an opportunity to use that data from these rural, or kind of, I guess, non-urban populations to improve models and make them more generalizable to populations outside of the standard academic medical center population. So I see it's really both ways that rural centers stand to benefit from the work being done at these large academic medical centers, but also large academic medical centers have, I think, an opportunity and responsibility to be building models that can apply well to these populations. So it's definitely nuanced in how we think about how these models generalize and making sure that they're appropriate to be deployed in these different settings. But I think there's a lot of opportunity there.
I would add that, AI-assisted chatbots have enormous potential in this kind of hard-to-reach population settings. Because one thing we're seeing now is everyone uses, digital health literacy is something we don't think about much, but everyone's kind of diagnosing themselves. Everyone has some sort of access to, digital social media or any kind of digital technologies. So the question is, how can we provide public information? What sort of, how can you design or adapt something for a patient's, not just in rural areas, but let's say, how can we make sure things are accessible to someone with a disability? Have very different, like visually impaired populations, etc. And can we reach them with the targeted kind of messages? So the same thing that Holly was talking about, but a slightly different kind of population needs. And the great advantage, maybe AI can be used to scale. We could do it at much larger scale and maybe more targeted and contextualized to patient needs.
Thank you both. So as we tape this conversation at the beginning of August, I note that in the last days or few weeks, some research from a few years ago has resurfaced in social media, talking about how AI can identify breast cancer 5 years before, I guess, conventional, mammography or other, diagnostic tools. I'm wondering if you can talk about that a little bit in terms of, if that research is now several years old, what do we know about it now, if anything? And what does that portend for how AI might be used similarly in other areas to identify disease before, conventional approaches can, what that means for saving lives, the delivery of healthcare? What can you tell us? Holly, I'll start with you on that.
I think these types of works of early detection or early diagnosis are really exciting and definitely one of the opportunities to do something that hasn't been able to be done before in healthcare. So I think what's great about seeing something like this resurface several years after publication is it really attests to the fact that this is useful in practice and has some years of validation to back up the claims that were originally made. And I think that is exciting and kind of rare at this point because we've had a lot of work in the academic communities of building these risk prediction models or prescriptive models for treatment recommendations, but it's very hard to move these into practice. And that's for many well-founded reasons. There are organizational hurdles, there are technological, like IT infrastructure hurdles, and there are also regulatory hurdles of what will the regulatory landscape look like that I think gives a lot of centers pause before implementing something like this. And so there's definitely work being done and work that needs to be done to bridge that gap of research into practice. And so I think there's a big opportunity for researchers like ourselves and hospital systems to learn from examples like this to see how something can be deployed or validated over time to build that credibility and to really make it a sustainable change to practice beyond something that we read about in an academic journal. So I think in the clinical side, there's definitely more work to be done, but there is a lot of promise.
I just wanted to add that actually in this case, for women, the risk of breast cancer is typically calculated using, I think it's called a BCSC, Breast Cancer Surveillance Consortium risk model that uses basically a lot of self-reported and other informations. And it seems to me that the clinical risk models, they gather data from maybe a set of sources, but maybe advances in AI, and especially in this case, it was this interpretable, I think, deep learning type methods that were used. Maybe they were identifying the changes in the tissue better than standard predictions. And, that is the key. So it's like, what kind of data are we taking in, which is very hard to do for a standard model that is not available. And I think that's where the AI-based, predictive advantage is coming from, right? That's really the fantastic thing. Maybe this is great opportunity for researchers.
As we all know, Congress and the White House have been working, for some time, thinking about the role of legislative approaches or regulatory approaches to AI. As it comes to the healthcare portion of AI, right? Healthcare is already one of the most regulated, fields or industries in the United States. But what are some of the most important things that policymakers should be thinking about when it comes to AI in healthcare specifically, as they're thinking about potential paths moving forward legislatively or regulatorily?
I would say, the challenge, Holly has already alluded to this, but when we are deploying these large AI systems, biggest issue we have to worry about is there a disparate impact? in how it's affecting different groups of population. And let me take one specific example. There was this study which looked at racial bias in an algorithm which was used to manage, sort of population health. So researchers did this sort of an audit of how patients were being, the predictive algorithm that is used to assign people to different care categories. It's kind of systematically undercounting the risk faced by, some racial groups. And it turns out when you dig deeper into the data, there is a reason for that, because the predictive categorization of patients was being done based on how much healthcare costs each patient incurred over, let's say, last few years. But minority populations don't use the healthcare system at the same rate as, other populations. So then the challenge becomes that what are the metrics we are looking at when we are building our algorithms? And of course, there's solutions to that. I'm not saying AI also has the solutions to the problems that AI causes by just doing more auditing and building better predictive models, or having some self-correction, or like looking at these complex sort of feedback loops between the different things that we are using in our predictive models. So this is, I think, one of the great examples where not only we can find the bias with AI, but we also know how to solve the bias with AI. And I think that's the model for the future. We are also, as a society, we are just learning how to use AI at scale. So we just have to be open to constantly looking ahead and seeing, can we sort of be proactive in addressing some of these issues and keep on that learning trajectory.
The only thing I'd add is a second component to thinking about AI safety or safe deployment beyond the disparities that could be revealed in a model. There's also a risk, or definitely a real possibility, that over time, models' performance will degrade. As something's deployed in practice, we can't just approve something and then say, put it into your system and never look at it again, because populations change, treatments, the standard of care changes, a lot of things change that require kind of ongoing monitoring and continuous evaluation. And even the way that we evaluate these systems is changing, especially as we think about things like generative AI that falls outside of a lot of the traditional modalities of evaluation that we used before. And so I think there's questions about, how should we think about approving AI models and allowing them to be in practice? But then how do we also ensure that organizations and researchers are kind of accountable to safely monitoring these over time and making sure that there's kind of continuous watch over them?
It's called model drift, what Holly just said. I think that's what we have to watch for.
So I think that's actually a great bridge to a little bit of a conversation around innovation, right? AI, generative AI, seemingly is moving and advancing very, very fast, much faster than governments can. But I'm wondering, as we think about innovation, and where's it coming from? Is it the private sector? Is it work that's being done in academia that is then being transferred into the private sector? What are we learning from a global perspective, right? At one point several years ago, there was a bit of press because China was experimenting with, I forget what it was called, but basically a doc in a box, right? Where you walk into a telephone booth kind of thing, answer some questions, it body scanned you or whatever it did, and was giving diagnoses. So do we have a policy? What's the private sector doing? What's academia doing? Understanding what's happening domestically and internationally, and how do we leverage those innovations to drive new innovations and to appropriately deploy them? And so I just asked a lot there. I'm sorry, but Anjana, I'm going to toss that one to you first.
It seems like healthcare is actually an area where academia is doing fantastic work, because you need that kind of clinical expertise and deep domain knowledge. But it's still very sobering. If we look at the trajectory of AI, it seems very much controlled by, private industries leading. So look at OpenAI, or if you look at Google DeepMind, well, they have done fantastic work in the area of healthcare. The huge large foundation models that have been built by everyone. Now, Meta has, there's almost like an AI arms race. So that leaves the question for us as researchers. What are we supposed to do? Should we all advocate for open source foundation models that are maybe domain specific, appropriate for, clinical domain, or it can be appropriate for individual domains and scientific knowledge? So what's the right approach for us, and what should governments do in sort of helping this kind of innovation? Because all the gains from these large AI models, how is it going to, at a societal level, what is it going to do? Does this mean that how do the middle school students of today, or, medical practitioners of today, how are their jobs going to be affected by AI? So I think I don't have a simple solution, but I think this is where the partnerships between maybe industry and academia, or government and academia, can help in setting up maybe some more we can invest in building not as huge large open AI level models, but maybe smaller foundation models, open source models that can help in research, that can be used in public health, that can be used, in healthcare sector and in clinical prediction, healthcare ops, and so forth. I think that's something that we should all be very aware of, and understand that not everyone is going to, chat GPT and those kinds of things sound very cool, image generators, but those are models trained on very large aggregate data and may not be so useful in specific applications. So we really have to understand how to harness and how to shape our own future in some sense. I don't know if this answer is too general.
That was great. Holly, I'm going to turn it to you, though, to see if you want to add anything in terms of innovation being driven from academia, the private sector. What are we learning from other nations, et cetera?
As Anjana mentioned, a lot of the excitement, I think, is in industry because they are so well funded. And especially as we think about large language models, which have really, dominated the AI conversation in the last year. The funding that the private sector has is unbeatable, basically. But I think a lot of the opportunity for real transformation is through collaboration between industry and academia. And I think the government has a large role to play in that, domestically and internationally, that the government has the opportunity to shape some of this work through funding, right? Building funding opportunities that encourage innovation and encourage kind of interdisciplinary collaboration between academics and industry. A lot of the fundamental research that's being done in academia could hugely benefit populations, but doesn't get that far because of either lack of funding or the lack of kind of a connection into practice. And I think that that's an opportunity that we can offer from the academic side. And so I see a role for government in funding kind of these collaborative efforts. And then also, as we just talked about a few minutes ago, in regulating this work, making sure that it's done safely. But I think there's this interplay between kind of the industry, the fast pace of innovation in industry, and some of the methodological kind of advances that are happening in academia and government as sort of an intermediary. I think COVID-19 is a really good example of what can be achieved when these different groups come together. So COVID was this time when we had such an opportunity and need to learn from data and get actionable insight very rapidly. And I think we saw a pretty unprecedented collaboration between industry and different private sector companies building technologies for diagnostics or for triage and things like that. We also saw academia doing a lot of that work in parallel and collaboratively. And I think that these efforts spanned, countries' borders in a way that we haven't seen that often. And so I think it's an encouraging sign to see that when something really pressing kind of hits globally, there is a lot of power that can be unlocked by bringing together government, private sector, and academic groups all kind of aligned on the same mission. And I think that model of innovation, hopefully, we can learn from in the future.
COVID also shows us the value of multimodal AI. That's not just, you had all these location-based services like Google mobility and data that shows sort of real time what people are doing, where they're doing, and so forth. You couple that with all these other kinds of data from hospitals, healthcare. And so you get very detailed, granular trajectories of how people are, where people are doing what and which points of time. And that sort of gives this unprecedented visibility that all these healthcare predictive models can really do a great job of predicting, the next big, it can be public health outbreaks, it can be, all sorts of personalized medicine, very contextualized to people's lives. And I think that's a great opportunity for us.
That's awesome. So I'm going to build on this, and I'm going to ask a sci-fi-ish kind of question. But Jana mentioned something in passing about concerns about jobs or the jobs of the future or job displacement. I apologize, I forget exactly how you phrased it. But it makes me think about this. AI has been known to pass complex exams for different professions, and if it can do that, and if it can diagnose things the way that we're talking about, and if other technologies like the doc in a box idea, evolve, is there a future in which AI displaces doctors? Will we need doctors in the future if AI has the capacity to do all this? Or how does it change then the architecture of the healthcare profession, I guess is the way to say that. And I'm going to toss it to Holly first, not giving you a lot of time to ponder that. But again, it's a sci-fi question, but I think it's one that probably isn't too many deviations away from possible real futures.
I would say, in short, I don't think that doctors are at risk of losing their jobs or being replaced. And I think that stands for all different aspects of the healthcare professions. Because I would say, I think that AI and humans are largely synergistic as we think about in many industries, but in healthcare in particular. There's strength to AI, like we've talked about today, the ability to learn from these larger data sets more than any one person can kind of ever see in their lifetime, and finding the signal in this messy data or in these subtle imaging differences like the breast cancer detection models. But there are also unique strengths to humans and the interactions that they have with patients, and understanding these nuances that aren't even necessarily captured in data in an electronic medical record, that I think we really need both. And previous work that we've seen in recent years is, I think, really promising to show that the future likely lies in these hybrid systems where we have both humans and algorithms being used to predict risk or to make treatment decisions, where there are examples that you can see in the literature that these hybrid systems where you kind of combine humans and algorithms can outperform either source on their own. That using them together is better than a human on its own, but it's also better than an algorithm on its own. And I think you can think of that as, in a sense, imagine you have a model that's very good on certain easy cases, and it can kind of automatically resolve these easy cases. That allows people to spend more time, the human experts to spend more time on the harder cases that their expertise is really useful and kind of uniquely able to disentangle. And so I think these kind of hybrid systems offer a lot of potential, but even beyond these quantitative metrics, how accurate a system is at diagnosing something, I think that it's important for us to remember the relational aspect of healthcare that is impossible to replicate. That you mentioned this doc in a box type of future, and maybe there is an opportunity for that in some cases, but I think that often and in many settings, there's a really critical value to this patient-provider interaction. That providers can pick up on subtle cues, but can also communicate and build trust with patients and things that build their medical literacy, like Anjana mentioned before, or encourage them and kind of improve their adherence to care plans and ensure their continuity of care. When they have a doctor who they know is going to be checking up on them every 6 months, that encourages people to kind of stay on top of their health. And so I think there are kind of quantitative benefits to having humans and algorithms working together. And I think there are definitely just kind of human aspects to it that are important. And unlikely to and probably shouldn't go away. Anjana, I don't know what you have.
I think there's some kind of internet meme, which I will refer to. In 2015, I think Elon Musk or someone said that we'll have self-driving cars in 2 years. 2016, some AI guru said radiologists will be obsolete in 5 years. And here we are in 2024, where radiologists are driving to work in regular cars, or driving cars. So I think we'll all adapt. That's the future. Is AI augmenting work is the model of the future. Digital skills or AI, I think that it's kind of like, just like we're talking about health literacy, some AI literacy is going to be a precondition everywhere in the world. And we will all adapt. And I think Holly already gave all these wonderful examples of how AI is not going to replace humans in the field of healthcare.
Let me ask one final closing question, right? And so Informs represents a diverse set of professionals, but our fields of interest really center around operations research, advanced analytics, data science. And I'm wondering if you can help our viewers understand a little bit more, not too detailed, about how our fields really contribute to the development and deployment of AI technologies, particularly in healthcare. And Anjana, I'll go ahead and start with you on that.
Ultimately, operations research, the ORMS community, it's really all about automated decision making using a toolkit of methods. AI has become sort of, you can say a lot of things can be considered artificial intelligence or decision support, but the bigger thing to me is that use of decision making in different contexts with maybe model sets, toolkits. It can be predictive analytics, can be machine learning, can be all these multimodal foundation models. The key thing really is, that sort of automated decision-making systems in a variety of contexts. And that's what we do. This is our identity. This is like who we are. We understand that interface, I think, really, really well. And I think that's, in a sense, our larger contribution for many decades of this community has been in variety of decision-making contexts, use of these quantitative combination of tools to bring in deeper insight and, be better at model building. That's what we have done. That's how I would put it.
Thank you. Holly, would you like to augment that with anything?
I would say completely agree. I think when I've been studying operations research for 10, 12 years now. And I think from the beginning, what really drew me in was this idea of data-driven decision making. And I think that idea is what kind of lies foundationally in AI and in a lot of the things that we do in the Informs community. And so we're using optimization methods and machine learning and AI methods to gain insights that can lead to better decisions. And I think this grounding in the problem, really deeply understanding a problem, what is the tool that's needed to tackle that, and what is the translation into an insight that will enable better practice. That's something that the Informs community spends a lot of time thinking about, and that problem grounding in context is particularly important in healthcare, where there's so much nuance that as an operations researcher, I don't know the details of these oncology pathways or things like that. But by working with clinical collaborators, really deeply understanding a problem, we're able to develop tools that hopefully are useful in practice and can unlock some of this transformative power that we've talked about.
When COVID happened, the fact that as a society, we are able to get together and come up with a vaccine, that itself is a triumph of artificial intelligence, because AI reduces the amount of time needed to find candidates that are potential vaccines. There are so many different, things that are out there. And this whole thing of RNA-based vaccine development, the AI methods are maybe like the hidden sort of, heroes of the story. I think that's a great triumph for our way of looking at the data-driven decision making models.
Listening to you both, I'm reminded of the Inform's tagline of smarter decisions for a better world. And so with that, I'd like to thank you both for a really interesting and very important conversation today about AI in healthcare. And for our viewers, similar to our panelists, Informs has 12,000 members doing work in virtually every sector of policy that can be helpful in identifying problems and thinking through solutions that Congress and the White House and other governments may be interested in. And so if you have a topic, if you're interested in connecting with one of the resources that Informs has with our members or other resources, please contact me. My email address is on the screen, jcohen@informs.org, and I'd be happy to connect you with the right subject matter expert across the Informs membership. So Holly, Anjana, thank you very much for a great conversation and look forward to seeing you soon.
Thanks so much.